thank you all for being here. And Amy, take it away.
All right, so my main purpose for reaching out to our chambers of commerce is to inform our business sector about our COVID-19 vaccination status and our efforts in the county, which includes also telling some about our challenges that we have in getting our vaccine out there and why I'm really looking to partners to be able to help us with our reach out to our population. Our goal is to prepare for vaccinating essential workers. We aren't yet there to be able to start vaccinating our essential workers, but we know it's a large population, and we know that there's often barriers that workers have to getting to a vaccination appointment with scheduling and those type of things. And so we're hoping that our employers can help us reach those who want to get the vaccine. So we're looking to assess the number and types of essential workers that we have. So I have an assessment that's ready to be shared today. To be able to assess how many employers we have that are employing essential workers, the number they are, and the type of essential work they do. I have an assessment for assessing the challenges and barriers that you foresee your employers having, and we have the opportunity today to just discuss it so that I can collect that information and we can start strategizing. And then I'm just here to answer any questions, and Rebecca Austin's here to answer any questions that you have about the vaccine efforts or even COVID-19 as well. So my main agenda, the slides that I have to cover are vaccine facts and vaccine safety, the status of our vaccination efforts currently, our current groups who are eligible in Lincoln County, the basis for determining that eligibility and sequencing at the state level, the essential workers that we have, who they are and why it's important to have them able to access the vaccine, barriers to vaccinating the essential workers, and then how employers can help, and then just the rest is questions. So here are those basic COVID-19 vaccine facts. The COVID-19 vaccines are safe and effective at preventing COVID-19 illness. For the Moderna, it was 94.6, I believe, % effective, and the Pfizer vaccine was 95% effective at preventing COVID-19 infections in those who had received the vaccine versus those who received a placebo. And then they were also effective at reducing severity. For those who did get a COVID-19 infection, they did not have the severe disease outcomes that those who had the placebo did. So there were more hospitalizations, more disease symptoms like shortness of breath that are very concerning, and that's what they considered more severity. So the FDA only approves safe and effective vaccines that are tested through large, rigorous clinical studies. These are the gold standards of studies. They are double-blinded so that even the people that are collecting the information on them do not know whether someone received the placebo or the vaccine. So it really controls the possible bias that we may have, that we want this vaccine to work. All of that is controlled. These trials also had many more people included in the trials than normal. So normally we may have hundreds to 1,000 people in a clinical trial for these vaccine studies, but these emergency use authorization trials had 50,000 people in them across the two studies. So a lot of people were included. It included, I think, a quarter of each study population were 65 and older. There was about 25 to 30 that were people of color. There were essential workers that made up a large proportion of those groups, so they were well tested. COVID-19 vaccines are the safest way to build immunity against the virus that causes COVID-19. So the side effects that are associated with the vaccine are much more mild, much more mild than the potential risk of catching COVID-19 naturally. Vaccines are the most reliable way to prevent COVID-19 illness and death. And this is especially thinking compared to our other methods that we've been using of social distancing and wearing masks. Those are effective, but not as reliable because humans fail. But the vaccines are much more effective at building that immunity and being able to protect us if we do get exposed to the virus. COVID-19 vaccines prime the body to recognize and prepare for a COVID-19 infection. They do this by giving the body a very small code that teaches the body to create a very harmless protein that is normally found on the outside of the virus. So it doesn't include any viral material itself. It's not possible to catch the virus from the vaccine. So most of the effects that we have from having the vaccine are the result of the immune system working. We want those effects. So you feel some soreness in the site of the injection. So in your arm, you have some muscle soreness, feeling tired, having a low-grade headache, having a low fever, having some mild chills. Those are the most common side effects that are reported, and they're all considered minor. There are some adverse effects, but they're extremely rare. We're talking maybe 12 out of millions. And those are anaphylactic shocks. And usually those individuals have had some kind of past history of having severe allergic reactions to things. And those are the individuals that should consult with their medical provider before deciding to get the vaccine. Both COVID-19 vaccines that are available in the United States require 2 doses of the same vaccine. So if someone gets the Pfizer vaccine, they need to get the second dose of the Pfizer vaccine. If they got the Moderna vaccine for their first dose, they need to get the Moderna vaccine for their second dose. And they're required to have within 21 days or 28 days apart. The Pfizer is 21 days, so 3 weeks, and the Moderna is 28 days, 4 weeks. When you get your vaccine appointment, you would know which type of vaccine you have. You'll get a card. It's a CDC card that says the vaccine you got, the lot number it was, what day you got it, and where you got it. And then for us at our Lincoln County clinics, on the back, we write in the date of your next appointment and the time of the next appointment. For all of our vaccine clinics that we're operating, we have them spread out exactly the number of days that we need to have the follow-up dosage provided. So if we're doing a Moderna vaccine clinic, we have appointments available exactly 4 weeks from the date of the first shot, and you get that appointment before you leave. One thing to note is that it takes weeks for the immune system response to work. So that's one reason why we have the 3 to 4 weeks between the 2 doses. The first dose primes the body, it starts creating those antibodies, it starts creating the lookout cells. And then on the second dose, it really confirms to the body, yes, this is the thing that you're looking for. And it really produces a lot of those memory cells so that when you get exposed to the COVID-19 virus, those memory cells are already circulating in their body and they're looking for that protein and they're ready to attack as soon as you get it, rather than having to take those weeks with your natural infection that you may have gotten. Oops, computer seems to froze. There we go. The COVID-19 vaccines are free because the federal government has purchased them for us, or we have purchased them for ourselves with our tax dollars. But some agencies across the United States or locally may charge an administrative fee to provide that. Currently with public health, with our vaccine clinics, we aren't charging any fees. We are providing these. We don't have the software to be able to charge fees. So you can feel pretty confident that we're not going to charge fees, at least at our clinics that we're operating. If we do get to a point where some clinics are providing the vaccine or some pharmacies are providing vaccines, those private entities, they may choose to charge the administrative fee. And then even with the vaccine, wearing masks, social distancing, washing hands are still very important for preventing transmission, even when we have the disease, or even when we have the vaccine, sorry. We can carry around and we can share a virus even if we don't get the disease from it. We can be exposed to it, but our body is fighting that inside, but it doesn't mean it's not on our hands, it's not on our nose, it's not inside our nose and not yet connected to the blood part of the body where the antibodies are. So if I sneeze or cough or wipe my nose, even though I don't have disease symptoms, I don't have a disease, I can still share that. So it's still important for right now to definitely keep wearing masks, do social distancing, and wash hands. This is another tool, a much more effective and reliable tool, but it's one tool of many that we'll still need to use. All of this information came from the CDC's COVID vaccine website, which I have linked in on the end of my slides. And then the Oregon Health Authorities frequently ask questions about COVID-19 vaccines, which I also have linked in at the end. Just a quick note about vaccine safety. Again, only the safe and effective vaccines pass through the FDA's approval. It's currently under emergency use authorization. That was just to make sure it could get out fast enough. But the amount of data that we have affirms that it is a very safe and effective vaccine. And there's multiple safety nets in place still to monitor the safety. We have our normal safety nets, which is the federal government's vaccine monitoring system, the ACIP. And then we also have this VAERS system that normally watches and monitors vaccine outcomes. But then new for the COVID-19 response, there's an app called VSafe, which everybody gets the information for that app when they get their vaccine, and they can report their own symptoms directly to this database. And so we have millions and millions and millions of data coming in for these vaccines that we're able to compare, and they are still highly effective, very safe. So this is the status of vaccine distribution in Lincoln County, and this was as of Monday for our Board of Commissioners meeting. So with the amount of doses that we were provided at that point, we had distributed 96% of our vaccine allocation. And this is much better than the national average. I believe I saw the national average is about 50%. So we're doing very well. We have a pretty efficient process set up right now. We're partnering with Samaritan Health System, with our North Lincoln Fire District, our Newport Fire District, our PAC West ambulance, and a couple other partners, including the school district, to be able to operate these clinics, and then also doing some mobile outreach to long-term care facilities. So we are getting the vaccine out as soon as we get it. We are ready. As soon as we get a shipment, we can pop up a vaccine clinic and get people through. We have lists of individuals who have said that they want the vaccine, and we're working through on getting them scheduled. So to this point on Monday, we had received 4,100 vaccines and then had given 3,800 vaccines out. One thing that we're pretty proud of is our mass vaccination clinic that we've set up at the fairgrounds in Newport, the county commons. And we have been able to vaccinate 1,433 people over 3 days through that clinic, which is, if we estimate the number of people in Lincoln County who we assume would want the vaccine, who are also eligible because they have to be either 16 and older or 18 and older to be able to get the vaccine based on what's approved for the FDA. We are vaccinating in a given day at our mass vax clinic about 1.7% of our population who wants it, which I think is a pretty great accomplishment for a small county. So these are the groups that are currently eligible for COVID-19 vaccines in Lincoln County. Phase 1A, which includes our healthcare workers, first responders, and our long-term care facilities, and any other type of congregate living where people are living together. In around January 11th, we added childcare, early learning, and K through 12 based on announcements that were given by the governor. And then on January 19th, we added 75 years and older. So all of these groups are eligible to receive the vaccine from one of our clinics that we're operating. Though a caveat is that we're still prioritizing based on these phases. So if we have our wait list together and we have individuals who are phase 1A, we're prioritizing them over the other groups. We have educators, early learning, and childcare, they're prioritized over the other groups. Though with all that said, one of our most important things is that we will not waste a dose. And so if we had appointments still remaining open after our phase 1A and our educators had time to register, that's when we decided to open up to 75 years and older, even though the state wasn't allowing that yet. We knew they were going to be the next on the list. And so we decided to allow those individuals in to be able to make sure we didn't waste any doses. So the basis for eligibility in Lincoln County is based on governor directives, the Oregon Health Authority's vaccine sequence, which is being informed right now by the state's Vaccine Advisory Committee. That sequence is still being developed. And so we have a really defined sequence for phase 1A. We have a defined sequence for phase 1B, though there may still be some groups that could be added to phase 1B. And then phase 1C is not yet defined. And we believe that essential workers will be either in phase 1C or phase 1B. But when I get to my challenges slide, I'll talk a little bit more about why that's still difficult to estimate. We're also using the Centers for Disease Control and Prevention guidance. That's what the Oregon Health Authority is using, and that's what I've been using to aim to predict what the state's sequencing is going to be. And I included in here, and I'll send out this slideshow to Lori when I finish. I included in here a link to a document that was provided by the Department of Homeland Security on our cybersecurity and infrastructure security, which defines out what all of the different essential workers are. And so that's something that we've been using here locally to try to predict what possible groups of essential workers we'll have. These are the main factors that are influencing the sequencing determination. And this is based on discussions that our state's vaccine advisory committee has had with the Oregon Health Authority. So it's based on the amount of exposure someone has through their work or their living situation. So if you think about this, healthcare workers have an extreme amount of exposure if they're caring for people who have COVID-19 and they are providing medical procedures on them in a very confined space. Also, whether or not someone has the risk for severe illness. So individuals who have, or groups of individuals who have high hospitalization rates and death rates, those are going to be prioritized higher than those who have maybe more cases, but they're not as severe. And then whether or not someone is involved in the critical infrastructure of a functioning society to meet the basic needs of the society. So healthcare, food, water, shelter, those would be our critical infrastructure for daily life. Those three factors go in together to decide which groups should be prioritized, and that creates our sequence. So this is a visual of the state's sequencing as it was still effective yesterday, though these things are changing pretty rapidly and we're not often alerted to that they've changed until we see it on the website. So phase 1A is this group here. Lincoln County is pretty well finished with this group, and individuals in this group have had weeks to be able to get listed as wanting the vaccine. Their employers had the opportunity to let us know how many of their workers wanted the vaccine, and then were given the link to sign them all up. And they could have distributed that link out to their staff. And then we're currently in this phase 1B area. We're still vaccinating our phase 1A, but now we are also in this phase 1B at 75 years and older. We lumped in these groups together because being a small population, it can be difficult to make sure we have all of our appointments filled. And so we're moving just slightly ahead of the state. Critical workers, essential workers, are over here in this undefined area. So they're saying these groups will likely be next, but we don't know when, and we don't know in what sequence. And so that's one of our challenges of preparing to vaccinate our essential workers. So who are our essential workers? The state hasn't defined that for Oregon yet, but this is from the Centers for Disease Control and Prevention, and it's based off of that Department of Homeland Security critical infrastructure list. But they defined and they recommended that these essential workers would be included in phase 1B. Some of them were already included in our phase 1A. So firefighters, police officers, corrections, they were already included in phase 1A in Lincoln County. And then the CDC recommends to prioritize these groups: food and agricultural workers, United States Postal Service workers, manufacturing workers, grocery store workers, public transit, and then those who work in educational sectors. And those are already being included in our phase 1B group. Our teachers are already eligible. And then they define a separate group that are other workers rather than just frontline workers. So they consider this transportation and logistics, food service, housing, construction, finance, information technology, communications, energy, law, media, public safety, and public health. They put them into what they recommend for phase 1C. So Oregon's will definitely be different because our phase 1B is already different, and we're still waiting to see what Oregon will publish for the next groups that will be eligible. So why it's so important to reach our essential workers with the vaccine. One is because they provide that critical infrastructure for our basic needs. But two, they are at a higher risk of exposure, particularly those frontline workers who are doing their work on a daily basis in close contact, which is within 6 feet of space for an accumulation of 15 minutes with the public or their coworkers. They also can carry the virus home with them if they are getting infected through work, and then take it to the people that they live with, who then can take it to another workplace. And so as far as disease control goes, our workers who have exposure are an important group to be able to reach with the vaccine. This is a graph that I took from the Vaccine Advisory Committee. It was presented yesterday by the Oregon Health Authority, provided by their epidemiologists. And this table gives us a visual of what type of workplaces are having the most outbreaks. So they're organized by the number of outbreaks that they've had. And I believe these are reportable outbreaks. So that means they're larger. They have 5 or more people and 30 or more employees. So 5 or more people have reported having a COVID-19 case, and they have 30 or more employees. So up here, the highlighted ones are ones that are not currently included in one of our phases for the state of Oregon. So workplace is a very broad category that they just kind of lumped a lot of groups in together, which doesn't help us as much. But then if we get down to these ones that are more defined, we see our farm and dairy workers have an increased risk of being exposed to COVID. Food processing, factory manufacturing, restaurant, bars, other congregate settings, which we have covered with our congregate living situations. Construction, higher education, grocery store, religious facilities, and retirement independent living. And then the other ones they have here are people in custody, so prisons and jails, shelter, transitional housing, utilities, and hotels. So that's just something to have us think about when we're prioritizing and sequencing, making sure we reach those that have a higher risk of exposure. So some of the barriers that we have is that group of what essential workers are is still broad and poorly defined, at least at the state level. It is very defined at the national level. However, it's very comprehensive. And so it's a very long list. We don't have it listed in the Oregon vaccine sequence yet, so that makes it a little difficult for us to plan, but we want to be prepared. And that's why we've created this essential workers assessment that I'll talk about shortly. We don't know the number of essential workers that we have, and we don't know all the types of essential workers we have. So that's why we're assessing this. We have a limited and unreliable supply of vaccine. There is a vaccine shortage because it's just now being created. And then it's been difficult to predict when we will get shipments. And there's been times where we've expected to get shipments, but those shipments haven't been delivered at the state level for us to be able to receive them. There's also limited locations where we can provide the vaccine. And this is particularly due to some of the logistics of these vaccines, which are very delicate and they have to be kept frozen. And then once they are defrosted, there's a short period of time when they can be administered. So we have to make sure that we are near a freezer or refrigerator, and we have to make sure we have enough people to be able to administer those dosages within the very short period of time that they have to be administered. And then scheduling the vaccination time around someone's work schedule and their family care is almost always one of the biggest barriers for working people to get a vaccine, and that's based on flu vaccination data. They say it's difficult to be able to get away from work, and that's one reason why we want to work with employers to try to figure out ways that we can reduce the barriers. And then there's the hesitancy and confusion about the vaccine, and that's one reason why I'm out sharing information about vaccine safety. So here's how employers can help. We have a Lincoln County Essential Workers Assessment that's going live today. So this group is the first group to receive it. I will copy the link and post it in the chat box when I get done talking. And it's a pretty short assessment. It should take less than 5 minutes, but it basically asks employers to identify one point of contact for us that we can then coordinate with to share information out about vaccine eligibility and to answer any questions, and then to coordinate if there's barriers to getting staff vaccinated. So we ask you to ready your staff, designate someone, inform them about the vaccine, and then create plans to help staff be able to access the vaccine. What we've done in the past is when groups have become eligible, we send out a scheduling link to that point of contact at the agency or the business. And then they can either forward that out to the staff for the staff to schedule themselves, or they can schedule people and stagger them into these appointments based on the schedules that they already manage. We ask our partners to help staff schedule their vaccines. That is the biggest barrier for them to be able to access the vaccine. And then to help us identify and reduce any other barriers. And that's why we have the rest of this meeting available to talk about those barriers or to answer those questions. A bonus, if you're someone who's really excited about helping with outreach and want to help inform our approach, I have another survey down here. It's to assess barriers, the accommodations that you recommend, and then supports available. Those would be supports that you could offer. So let's say you're a large employer and you know it's going to be tough to reach your employers, or if you are an advocacy agency like Fisherman's Wife, and you think you could help with vaccinating that group of individuals, fill out this survey, let us know what you think that population has as far as barriers go, what kind of accommodations would help to make sure we could reach them. And then if you can offer your resources for your agency or your organization, that would be something that would really help us, especially if there's space available or you could help coordinate any such things. And I have that linked into this site as well, or into this website as well. These are all the important resources that I think are the best to highlight. This is our Lincoln County Essential Workers Assessment. This is the Oregon Bureau of Labor and Industries website about COVID vaccines and the workplace. I just had a call with a wonderful person from this agency to answer some of my questions to prepare for this meeting. So I have some answers to some questions I expect to get. The Oregon Health Authority has a COVID-19 vaccine page. This is where they post their sequence. And so you could check that out to see if anything on the sequence has changed. This is the Lincoln County COVID-19 vaccine schedule webpage. If we have a clinic that is open to the public to register, and by open to the public, I mean those who are eligible, so 75 years or older, or if we move to the next phase and get to 70 years or older, that link to schedule themselves becomes available on this website. Also, we have just started today a wait list. So even if you're not eligible and you want to make sure that we have your name and your contact information, you could go to this website. There's a link there that says enter your name into the wait list, and you can put your name onto that wait list. It will ask you what phase you think you would qualify for, and you will have to pick one of those categories. And that phase is really important because we are only allowing people to get scheduled if they qualify for a current phase that is eligible. We have a county COVID-19 vaccine webpage where we're posting all of our new information.
Amy, could I interrupt for a quick question?
Definitely.
I'm sorry. The waiting list, if I'm not mistaken, the waiting list is limited to people who are within 30 minutes of Newport. Is that still the case?
We have changed that. So we've just recently created a new waiting list for anybody who is interested in the COVID-19 vaccine. We will, when we get to doing our clinics, we will still be calling people if they live within that 20-minute radius of the clinic. So we have to collect addresses and phone numbers so that if we do have appointments that become available, we can call people within that radius. Before last week, it was just for people who were 75 years and older or phase 1A or educators. And if they were within that 20 minutes of the Newport mass vaccination clinic, because it was just a wait list for that specific clinic. And because there's been so much interest in the wait list, we've expanded that to be for anybody who wants the vaccine. If they want to give us their information, we'll collect it. And then when we have new vaccination events, we can send it out to them so that they can sign up if they're eligible. And then we can call them if we do have vaccines. There may be a point when we get more vaccine that our EMS partners are doing clinics up in Lincoln City or out in Waldport. And so they'll be able to contact people from that list. Let's say they have one dose that's left and someone didn't show up. They can call people from around there to make sure that vaccine gets into an arm.
So Amy, a follow-up question to that. Is there any way to know where you're at on that wait list?
I think when someone, if they call the call center, they would know where they are in the list. Other than that, I don't know how they would get that information. And that's something that maybe I just don't know of yet because I'm not the person putting the list together. And Rebecca Austin, I don't know if you have any information on that yet. This is a new development as of yesterday.
Yeah, I would say that we don't really have a good way of doing that in a timely way. Somebody would have to kind of scroll through a list. And at one point it was, almost 1,000 people on that list. So we've been sort of trying to figure out how best to do this. And we do tell people that if they get a call from the county that they need to answer their phone, because if they don't answer their phone, we just go on to the next name. So, and it will only happen on the days that we have the mass clinics, because what is happening is we're able to draw up more vaccine than we thought, because there's a certain amount that we can get out of each vial, and we're getting more. So that's why at the end of the day, we're like, hey, we have 20 or 30 extra doses here. Let's start calling people. So that's what we do. And that's why we have the radius, that we need people to be able to respond pretty quickly to get there and get their shot.
And I think someone's position on the list would change pretty frequently based on others being removed from that, but also based on eligibility.
Right.
So if 70 years and older becomes eligible, then that list is going to be resorted so that we can pull those individuals who are 70 years and older. If the state defines that another group that's going to be eligible simultaneously with seniors 70s and older, and they say people who have certain types of chronic conditions that are high risk for COVID outcomes, if they add that into phase 1B, then we'll resort that list and we'll be pulling individuals from those groups. So it would be a pretty dynamic list, and it would be difficult to say, like, you're officially this number, and if you aren't able to answer your phone when we call, then that number is going to change again.
Hello, this
Okay.
is Kathy. Can I speak?
Sure.
Okay. So I had my first dose, and this was a couple weeks ago in Newport, and I am one of the ones that got called, and they said, come right in, and we did that, my husband and I. And just FYI, I had no reaction, just a little soreness. But it's been very confusing because the governor and the TV is saying only people 85 and up, and and not until February. Some of the dates are, and so I in one instance I have a friend that has scleroderma, which is a very compromising illness where her organs harden. And she's been trying to get on a list, just to get on a list to be able to, a waiting list, and hasn't been able to find a way to get on it. And she lives here in Lincoln City. Many of you may know her husband is Greg Harrison, who's a CPA, was in Newport for a long time. And so I gave her a phone number, the phone number that I called, and she didn't get through with that. So the one that you have highlighted here, is that where the link is, where the website is for the waiting list?
Yes, the vaccine schedule page has the waiting list linked on there now, and that's brand new as of today. And this type of issue is exactly why we've created that waiting list that's a little bit more accessible, rather than having one that's based on each clinic. It would be easier if individuals could just put themselves on the list, and then we can filter through as we get more vaccine in and move through the groups. We have moved a little bit faster than the state has, and that's just because we have a smaller population. So it doesn't take us as long as it would take, say, Multnomah County to be able to move through a phase and to offer the vaccine out.
Okay, well, that's great. It's just when you're watching TV and it says not until February, and she was told not until March. So, and she is one of these people that really needs one desperately, so I will give her this information, and thank you for sharing all of this with us.
Okay, Estelle Harlan, do you have a follow-up question, or did your question get answered about the waiting list?
Well, the follow-up question is that I was on a waiting list. I signed up for the waiting list last week. I'm hearing today that because I do not live 30 miles within 20 minutes, that you probably dropped me. Will you put me back on? I live in the north end of Rhodes End also, but Lincoln City. And it's definitely not 20 minutes away. So how do I know I'm on a list?
So we used the list for 2 reasons this week. So this list was the wait list for last week's clinic. And what we did with the list was we had 617 appointments available for the clinic that's happening today. And we went through that list, prioritizing the phase 1A groups, and we got them scheduled. They went through and they emailed and called them. And then once those individuals had the opportunity to schedule, they went through and reached out to the educators, childcare, K through 12, based on the sequencing that we're required to use, and reached out to them and got them scheduled. There were also individuals in the intellectual and developmental disability community that are part of the phase 1A group that weren't able, they have more barriers to getting scheduled. And so we did a lot to make sure we were able to get those communities scheduled into this clinic. And then after that, the list would be open to 75 years and older. And I believe a lot of the appointments were filled with those first 2 groups. And then they went through and they called and emailed those that were in the 75 years and older to fill those other appointments. So you're still on the list.
All right, another question in the chat. If I'm transporting an elderly person who needs assistance walking and can't stand for long periods of time, will there be seating available? Or just what is the process once we arrive at the clinic site with an appointment?
Perfect. For our mass vaccination clinic that we've been implementing in Newport in the county commons, it's completely ADA accessible. So it's a walk-through/roll-through clinic. There are also seats at every station. So when someone first comes in, they check in and there's a row of seats there. People come in groups of 36. It's really important to arrive at the top of your appointment time. So if your appointment's at 9:15, you would want to be there at 9:15, maybe even a little early. There would be a little bit of standing in line as that group checks in. But then once past that check-in point, there is seats there for everybody. And then as a group, they move into the vaccination area. So there's tables that are spread out. They do the informed consent as one group. So they talk about what the vaccine is, talk about what to expect, and then give the handouts that go with the vaccine. The vaccinators go through and they give you your shot, and then you roll through or walk through back to the back room where you schedule your second appointment, and there's chairs there to hang out in for the 15 to 30 minutes for observation time, and then you're free to go. Most comments have been that it was a pretty efficient, smooth process. It's pretty well organized. At least this is what folks are telling us. And from my experience of working it, it was very well coordinated.
All right. Is there a designation for individuals over 64 years old with an underlying condition as defined by the guidelines on the website?
And just to confirm, you mean old, so older than 64 years old, so 65 and older with a chronic condition?
Over 64.
Or 64 with a chronic condition. Currently, there's not. So it would be just, it would be waiting till the 65 and older, well, 64. So if it's somebody who's 64, they would be waiting until after the 65 and older. There will be one of the coming groups that's going to be put into the sequence next will be 16 to 64 with chronic conditions. So that would be one group that should be coming. I don't know if it's going to be placed at the same time as the 65 and older, or if they're going to be put into phase 1C. That's still what we're waiting on the state to define for us. I do know that the Vaccine Advisory Committee had 16 to 64 with chronic conditions at the top of their recommendation for the next group in the sequence, though the state still has to determine where that goes.
All right. I think we've got through all the questions in the chat. So I've got a question that I've been getting calls here at the chamber from both employers and employees. So can an employer mandate or require an employee to get vaccinated? Can you talk a little bit about that?
I did, and I did my homework on this one because I wanted to make sure I knew the answer to it. The Oregon Bureau of Labor and Industries, they say on their website that yes, an employer can mandate employees to get the COVID-19 vaccine. However, there are few exceptions. So one is that there's a state law, and perhaps our representative could explain a little bit more about that, but there is a state law that was passed that exempts healthcare workers from being required. And that's a law that dates back to the 80s. There's also another exemption if a union has in their collective bargaining agreement that vaccines are or are not a term of employment. That could be an exception. And then there's also personal exceptions someone can have. So if they have a medical or serious religious conviction that exempts them from the vaccine, they can get that exemption as well. So there's a couple exemptions, but overall, yes, an employer can mandate as long as they work through those different exemptions.
Okay.
And I also included the Oregon Bureau of Labor and Industries link on my website or on my PowerPoint so that everybody has that webpage to go to. And I called and confirmed that with someone from the department too.
Great. And you will be sending that to me so I can send that back out.
Yes. As soon as we're off, I'll send it to you.
Okay. Thank you. So does anybody else have questions?
Lori, first let me say that I think Lincoln County has been doing a great job. We are running ahead of virtually any other county in the state, particularly along the coast. I believe the latest rankings are that we're at 8%, where the average is around 4, and some are down at 3 or just below 3. So we're doing really well. The consequence of that is the state seems to be sending more vaccination supplies to areas that are playing catch up. So I guess my question, Amy, is in your crystal ball, what are the prospects for us getting vaccination supplies here when that resource is so very scarce and other people are not doing as well as we are?
I will yield that question to Rebecca Austin. She's a little bit more involved with the dealings at the state level and can speak a little bit more about that decision and discussion that's been happening.
Thanks, Amy. So this is Rebecca Austin, and we are dealing with that very issue right now. I don't know if some of you saw the Oregon Live article from an interview that Commissioner Jacobson and I did with an Oregonian reporter last night. We are one of 9 counties now that have been not able to get any vaccine for next week. Just our second dose, of course, they need to send us that so that we can stay on track. But we will not get any prime doses next week. And of course, Lincoln County isn't going to sit idly by and just let that happen, because we don't feel like we should be punished for doing a great job. And we feel like this is one advantage that rural communities have, that we can get our population vaccinated more quickly than larger population areas. And I think it's important, especially for the coast, that we do get our population protected, because we have all these people from all over coming to visit us and, you know, using our facilities and stuff. So we want to protect our population. So we are pushing back. Representative Gomberg, you're probably going to be hearing more about that, as we would like you to also continue to advocate for our rural community and stopping what we consider kind of unfair practice, that we want to just keep moving along here and get our people vaccinated. So it's looking like eventually, when the infrastructure is stood up at the federal level and they stabilize the supply chain, that we will be able to start pushing to the state what we need to each week, instead of them kind of dictating to us what we'll get. And we are really looking forward to that day, because and it could be, you know, 2 weeks from now, it could be a month from now. We don't really know when that's going to happen, but we definitely want to continue to advocate for ourselves out here. And so I think I've got our political forces lined up to help me with that. And so we'll just have to, like I tell everybody, you know, it's just so hopeful that we have a vaccine available. It's very, very exciting. And at the same time, we have to be patient to get it out to our folks. So that's kind of where we're sitting right now.
Well, you know, sometimes we politicians are in the habit of asking questions that we know the answer to already. And I'm very familiar with this problem, and I'm not going to be sitting idly by either. One of the articles that you just made reference to says that that Portland, that has 40% of the state's population, is now getting 60% of the vaccination supply. I've already been on the phone with the governor's office and with OHA leadership, suggesting that we really need to ensure that these scarce supplies are dispersed equitably and fairly across the entire state, and not just feeding them into the big metropolitan centers because they're lagging behind the rest of us.
Yeah, I couldn't agree with you more, Representative Gomberg. And also, I just feel like, the first question they asked us when I told them that we vaccinated 1,700 people last week was, well, how many doses do you have left over? I'm like, well, we have enough doses left over to get us started again next week. But, it was like 200 or 300 doses. We don't want to be down to zero, which, by the way, we will be after today. So I don't know that they're asking the same questions of the metro area, but they got 17,000 doses really in Multnomah County. Are they going to be able to distribute those in 1 week? Maybe not. I could use 300 of those for sure. I could use them. We've got a waiting list. We need to get people vaccinated. So, I'm grateful that I live in a community that believes in science and wants to get vaccinated. That's not true across the state either. So, we're primed to get the work done. So I thank you, Representative Gomberg, for advocating for us too and making us stink.
So I have one more question. Is there a phone number? I hate to say this, but there's a lot of people here in Toledo that are not computer literate at all. So is there a phone number that they can call?
Yes, we have the call center. I can drop that number in the chat box as well. And it's also on the schedule website. However, I will warn that we are receiving a very high volume of calls. And so it may take a couple tries to get through. One of our strategies that we're using to be able to reach individuals is to share out the wait list and this information out to our various service providers around the county, so that those service providers who are already engaging with individuals can also sign people up for the wait list, or when they are eligible, they can also sign them up for their appointment. So we're kind of using a systems approach to be able to reach people through the services or through their employers where they're already living, working, and receiving services through.
Okay, thank you.
All right, Amy had another question come in. How effective is the vaccine to someone if they are asymptomatic but have the virus when they get the shot? And do people who have had the virus need to get the vaccination? If yes, how does the vaccination work differently in the body?
I will answer the second question first. Yes, if you have tested positive for COVID-19 in the past, it's recommended to still get the vaccine because it's an added layer of protection. And right now, we don't know whether or not the natural immunity is as long lasting as the vaccine immunity. So it's not going to be counterproductive in any way. So it's beneficial to get the additional layer. It also could be, in a sense, a booster. So if you had the virus 3 months ago, right now our research says that people have been shown to have some sort of immunity from COVID-19 for 90 days, but we believe that immunity wanes off. So it would be beneficial to get the vaccine again as a booster to be able to have additional protection. Whether or not someone can get the vaccine while they have a current positive COVID infection, I'm not clear on that answer, and I would have to look that one up. Rebecca Austin, I don't know if you know that answer.
I do. In fact, we have also seen cases where somebody got the first vaccine, got COVID, and then wondered when they could get the second. So the word from OHA is that once their symptoms subside, they can go ahead and get the vaccine. So we don't want people who are sick with COVID currently. The body is already pretty overtaxed trying to make them well. We want them to wait until they get better and then go get the vaccine.
All right, thank you. Does anybody else have a question? Just go ahead and unmute.
Hi, Lori. It's Casey Miller.
Hi, Casey.
It looks to me like you're recording this conversation.
Yes.
Or where do you post those recordings?
We can put that on our website. I could also send it to you if you want to post it somewhere.
That would be fantastic. Yeah, one or both.
Okay, will do.
Thank you. Okay.
All right, so at this point, we're just kind of waiting for the next mass vaccination event, right?
I would say we're preparing for the next
Okay.
one. It would be really helpful if this essential workers assessment gets out to our employers and they start entering that information in there. It takes a lot of work to get prepared and to start being able to phase in different groups. So the more information we can get from our employers and begin to estimate how many essential workers we have in the different types of essential work, being able to say we have 300 grocery store workers that we need to vaccinate, and we have 400 in fisheries. To be able to really break it down by the type is going to help us, particularly since we don't know what the state is going to provide as far as what groups will be in the sequence and in what order. So having that information will really help us, and it'll help us have more clear information when it is time to start rolling in certain groups. We'll be able to say definitively, contact your employer. We're going through your employers to be able to give you out the link, and that will be the most effective and efficient way to do this.
So oh yes, Jeannie, go ahead.
Quick question, Amy. I just looked at the survey link you sent out. Thank you for including Parks and Recreation. I'm with Parks and Recreation Lincoln City. Question, how is this survey getting out to all the local businesses, Parks and Rec departments? How are you marketing so they know to fill it out?
We'll have a media release coming out today. So that is ready to go, and it's in the queue to be sent out. And
Okay.
then we'll also likely send it out through our emergency management response system, Lincoln Alerts, so that all the employers will receive it. We'll end up doing multiple approaches just to make sure it gets all the way out there. And then we're also sending out through our business partners like the Chambers of Commerce, so that those who are members will be able to reach it as well. So my general approach to life, being a health promotion person, is saturation. I go through all different areas. You probably get it 4 times, but that's okay.
Great. Thanks, Amy. Thanks, Lori.
Of course. So Amy, my understanding is you're also looking for locations for these mass vaccinations. And is that part of the assessment, if you're able to offer that?
So I have the 2 different assessments happening simultaneously. We have the essential workers assessment, which is really the most important one for us right now, which is identifying all those possible essential workers that we have and identifying a point of contact through our businesses that we can coordinate with to be more efficient. Then I have the outreach assessment that I have that's assessing barriers. It's assessing accommodations that are recommended, and then the supports available. So that would be the other assessment to identify if you have a space that you're willing to lend us, that you would want to partner with us to be able to do outreach through. That would be the barriers and accommodations assessment. And that one's really like the bonus assessment. I really want to highlight that the essential worker assessment is the most critical one. At this point, we need to know how many people so that when we get amount of doses, we know where to reach out to. The other one is we still have quite a bit of logistic issues to be able to do additional locations. So I'm collecting that information, but it's going to be a little bit longer down the timeline before we're able to do some outreach events. And it really relies on having more vaccinators, more vaccine, many other factors that we still need. So it's the lesser priority at this point. But we still, if there's resources to be provided, I definitely would love to have that.
Okay, so are both assessments available now, or are we sending out the essential worker assessment first?
I think I want to turn that back to you. As business people, what do you think would be best? Would it be best to send them both at once, or would it be best to send the essential workers assessment the priority first?
Well, they kind of go hand in hand. So we need to know how many and where we can vaccinate them. So, unless anybody objects, I would say they're both important at this point.
And what
My experience with it, Amy, is I received the one not about the essential worker, the other survey yesterday. I thought it was for the essential worker survey. So I got confused between the two, even though I'm sure the wording was very clear. So when I saw the new one that you just sent out, I went, oh, this is for us to let you know. So just from my experience, it may be beneficial to send the first one out and then follow up with asking about locations. I don't know if anyone else had that experience.
All right, we can definitely do that. And then, you know, we can wait a few days so it's not confusing. But however you want to do it, Amy, we'll do it, whatever the easiest way for you to get the information in, and less confusing for everyone out there, because there's so much information floating around.
I will share, I think, well, I guess the question I have is, what I tend to do is create an email that has everything in it and that just bullets it out. Would that be okay for me to send you that email with the PowerPoint slide, with the links in it? I'll send it to you, Lori, and our other chamber leaders, and then you can forward that out as one unit. I think it might be easier if I specifically say in there that this is the biggest priority and really bold that. And then also the other ones in there so that's not confusing when it comes back up and it's like another assessment, I already did this assessment. Just thinking of, I think I can prioritize it in the email itself.
Sounds great.
And then the one that'll go out through, I don't intend to put the barriers assessment out through a media release and out through Lincoln Alerts. So the essential workers assessment is going to have the biggest push, if you will. And the barrier assessment is just going to be like a little bonus piece on the end for this community.
And Amy, if you would just kind of keep us posted on your response, you know, maybe we'll need to send it out multiple times, but if you're not getting a good response, then we can talk about other ways to get that out.
Perfect. I will do that.
All right. Any last questions? All right. I don't see any in the chat. Well, thank you very much for all that you're doing. I know it's been a whirlwind for everybody at the county and county health. So we definitely appreciate everything that you're doing.
Thank you.
Thank you for doing this call, and thank you everyone for joining us.